Oh, God, here we go. I've literally got no beds. What does the stork bring now? You know, Simon Carley was right. Neonates are aliens and pre-human. I hope to God it's not cardiac or a weird metabolic thing. It might be an ex-prem or sepsis. Do you know the stakes are always so high, and emotions? I'm going to have to manage the team, the retrieval staff, the parents, let alone the patient. I'm going to be up all night with this. All right, let's find out.
Baby's not breathing. Okay? Try someone check the heart rate, please. There's no heart rate at all.
What the hell happened? This was supposed to be a normal delivery. Why isn't the cot set up? Okay, baby's not breathing. Fine. Quick, bag and mask, go. Okay, give me a heart rate. What? Start compressions now, quick. Okay, right, seal's okay, turn mask, fine. I'm not getting much chest movement. Where's the near puff? I thought we had a near puff. Well, get it out of the cupboard. Oxygen, quick, crank it up, come on. Yes, 1, 2, 3, breathe. 1, 2. Check again the heart rate. Feel the cord. Is that SATS probe working? Shit. Okay, all right, I'm going to have to go for a tube. I need access, I need adrenaline. I can't do this on my own. Can you just call Nets? What's happening? Why isn't he crying? There's so much noise, so much commotion. What are they doing? Just give him to me. It's not supposed to be like this. I don't like the look on that midwife's face, the way they're looking at each other. What's happening? She's panicking. What are they counting? Did she just say no heartbeat? Is his heart stopped? Not my baby, no! Please, help, help! Is he on the phone too? Fuck. So wherever you fit in a neonatal retrieval story, how do you make a difference? That's what this conference is about, isn't it? Everything you're going to hear comes from real feedback. You ready to hear it? Tertiary practitioners in your ivory tower, listen hard. Concentrate. Don't interrupt. Don't criticize me. Don't assume. More than anything, just don't be an idiot. Check yourself. Listen before you speak. Learn to develop some insight into how you sound and deliver. When you find out where they're calling from, pick yourself up and put yourself right down in the center and look around you. What resources have you got immediately available? Especially if you are remote and it's going to take ages to get a retrieval team to these guys. You might have the luxury of a GP anaesthetist, a rural pediatrician in another town half an hour away. Or maybe you're so remote the next skilled pair of hands that might be available might be a paramedic team you might have to task to the hospital. Know the difference between what's desirable and achievable in a retrieval environment. Sure, I would love to know the cord gas, mum's GBS status, and what does a chest x-ray show? But try and don't demand things, and then don't express your frustration when it doesn't happen immediately. Things that happen in a heartbeat in your own hospital, why not in another setting? You've probably little insight into the level experience of the person that you're talking to on the phone. They may have way more information than you and know the capabilities and the limitations of their staff that they work with. and actually what's worked really well in retrieval before and what hasn't. So if they're giving you this, listen. If you have a really constricted or rigid mindset in how you want to run this resus, what you would do if you were right there now, think again. You might actually be really distracting and interfering from the guys who are actually trying to resuscitate this baby if you just want to run it your way. So ask them, maybe, how can I help you most right now? The answer might be, just come, just send a retrieval team. Fine. If you hear that, confirm you are activating a retrieval team. And then offer clinical support when they're ready. It might be something really specific that they want. Maybe a drug dose, maybe procedural guidance. Fine, give it. But please don't bombard them with questions. And just because you want to fill out the triage form, you're going to start at the top and go down. And how many pregnancies has the mum had? Is it helpful at this point? Surely use a later opportunity to get all that information. It's important, but you just don't have to ask it right now because you might forget a little bit later. If the answer is, just help me, sure. You go for it. Lead this resus remotely. You do this with your eyes closed. But keep it simple. Don't use jargon. Step by step. Reduce the cognitive load of the people you're trying to help. Give an action, assess a response, move on. You can nail this. You do this all the time. Don't keep rabbiting on in their ear, though. Rambling on. You come up with an idea, it sounded great, so you're going to repeat it a few times. Don't talk over them. And now is actually not the best time to discuss and present the evidence. Know when to pause, when to shut up, and let them assess the patient and help them. If you are going to give something specific advice, let's say a random drug dose or something, how are you going to minimize error? If you're using something like the NETS calculator or app, how do they want to receive it? Are you going to read it out to them? Why don't you ask them, how can I help you most? Do you want it to your phone? To email? Or shall I fax it to a locked office somewhere? Do you want to log on remotely? Punch in the numbers, you work it out. But just try and help them if you are asking for something specific. Let's just say things aren't going quite so well. An ET tube has been inserted. The team are persisting on. But your gut feeling tells you something different. There's a discrepancy here between what the treating team feel and you. How do you handle that? It's difficult. Could you start with something like inquiry? Do you think the tube is in? If that really doesn't register and they're persisting on, maybe something like a 2-challenge rule, where you rephrase the question and then throw in some supporting advice, evidence. Do you think the tube might be dislodged? The SATs and the heart rate aren't really responding. Let's reassess. Give them an option. If they're really not listening to you, what are you going to do? Could you go for something like a critical language model? I'm concerned, I'm unsure, this is a safety issue, stop. I'm concerned we're not ventilating the patient. Could the tube be not in the right position? Why don't we reassess? Stop ventilating, pull the tube, go back to bag and mask. If you are a remote practitioner and you're using NETS, call us at the earliest opportunity. It's easy to say when you've got your hands full. Doesn't matter who you are, just give us a name and a role. You are our contact person. It's great to have one person to talk to. You don't have to be the most senior clinician or doctor in the room. It doesn't matter. Just let us know who you are. This sounds ridiculous, but honestly, it's embarrassing when you get this wrong. Let's make sure we're talking about the same place and exactly where you are. Nobody likes a baby hunt when we get there. Do we go to ED or the ICU or the labour ward? I can't remember what they said. Where are we? We want to get there in the shortest time frame possible. Please don't make it a hunt at the other direction. And if you are on a conference call and you're a latecomer, you've probably missed all the interesting introductions and where they're calling from. But just make sure you have some call etiquette. You introduce people. Again, the logistics are a little bit different if you're calling from Nauru or Christmas Island. It's not that straightforward. Keep talking. The advice might be, call back if there's a change in patient condition. Great, I've just invited you to phone back every 5 minutes with a change of heart rate. But let them know if there's a significant event or a clinical change, for the good or bad. The worry and concern people say, well, if the patient's getting better, you won't come, NETs won't come. It's usually not the case. You get the opportunity to re-triage. It's difficult if you run a statewide service, limited resources, competing patients. Just help us use this properly. You might actually have an impact on patient safety and actually of the retrieval team. 3 o'clock in the morning, we're going hell for leather, priority 1 to you. Country roads in Australia, wildlife, contending with everything, weather. So if we do get an update that the patient is more stable, fantastic. I love to hear that. But then I can step down. Priority 2, just go a little bit gentler, and you might actually impact on the safety of your team. Everyone's question, where is NET? Jesus, whether you're the person calling or you're the tertiary specialist receiving, where are we? Now, I'm not likening NETs to a taxi service, but I think we could do better. Direct feedback has been, I know when they're sprinkling cheese on my pizza and it's coming round the corner. Where the hell are the team? Why am I in the dark? The life-saving retrieval team. So maybe we could do a bit better. NETS WA developing an app, confirming your order, NETS team preparing, NETS team dispatch, say hello. We do have frequent flyers, so I don't know how to fit in that $10 off next time, but we will see. But maybe we can communicate better with people. The other thing, it's really hard when you separate a sick baby from their parents. It's huge stress, anxiety. It's terrible. But don't you think with GPS tracking in every vehicle, aircraft, we could do better? This baby belongs to them. Unique patient identifier number, barcode. Surely we've got the technology to do this. Why don't we with the parents? Why don't we say, so at any moment in this retrieval process, you can track your baby, you know where your baby is. And more importantly, when your baby arrives safely at the hospital. Now, parents always feedback they love getting that call to know that their baby has arrived safely. Thank the Lord God, it's been a few hours. But it's not always the top of everyone's priority list. Sometimes it's delayed, you've got handover to do, the patient's unstable, you forget, you've gone on and think, oh shit, I forgot to phone the family. Was it my job? I can't remember. Oh, the nurse will do it probably, who's got them? Probably. But it shouldn't be low on that priority list. It's a vital step. And parents shouldn't be kept in the dark. Surely they've got the right to know, real time. Integrating parents into patient care is a huge part of neonatology, and John Hunter Hospital in Newcastle have just nailed this. They've introduced NICView cameras, 42-bed nursery. Every cot has a camera directly over the baby, and the parents at any time, from any device, can log on and see their baby. How lovely is that? Sure, there's protocols, guidance about it when it comes to procedures and things. Can we not just start a conversation about translating this across into retrieval medicine? Maybe. Do you think it would make a difference to the family to have little updates that they can see their baby? Perhaps you're doing an interstate retrieval. They take hours. How lovely just to get a snapshot. She's doing fine, in good hands. We're going to take off now. I think that would make a huge difference. How many hours have I sat looking at this needle? If you run a retrieval service, invest in your team and equipment. If your goal is to provide tertiary neonatal care regardless of geography, anytime, anywhere, sounds pretty good. Good old Stefan ventilator. Does exactly what it says on the tin. Probably. I don't really know the tidal volumes we're achieving. The accuracy is just beautiful. So think about it. Think about translating what you do in the NICU every day. Synchronized modes of ventilation. And tidal CO2 monitoring makes it safer. It's quieter, it's lovely, beautiful touchy-feely screen. Okay, I can measure tidal volumes. As the lung compliance is changing, I can do this safer, I can do this better. We can whack in nitric. This is what neonatology is about. It's way sexier than the Stefan. And invest in your team. I can't say more than this, but make playtime, whether it's skills and drills, emergencies, your equipment, make it fun and play together every day. More than anything, support them. Take care of them. We do a morning debrief. It starts with team chats. Probably I'm going to answer yes to all of these at the moment. Make sure every part of your retrieval team is retrieval ready. And if they're not, do something about it. Can't say this more than enough, but care for your retrieval team. So whoever you are in neonatal retrieval, help make a difference. Thanks.